Good morning, everybody, and welcome. My name is John Grubeski. I'm with Geisinger, and we are here for the Geisinger Health Plan Employer and Broker Town Hall. Today, we're going to hear from Jay Wan, who is President and CEO of Geisinger, Kurt Roble, who is CFO and interim leader of the Geisinger Health Plan, and Allison Hess, Vice President of Health and Wellness for Geisinger. As a reminder on your screen, we will be taking questions throughout the presentation. If you are in the full screen of the broadcast, you'll not see the option, so you need to minimize. And there's a way to submit your questions, and we will be monitoring that as we go through. As a reminder, this is being recorded and will be placed on the employer resource page, and we'll follow up with information on where you can find that after the presentation. But we're ready to begin, and we'll throw it to Dr. Jaewon Ryu.
Thank you so much, John, and thank you everybody for joining us today. I think it's been, I was just reflecting on this, I think it's been a month or more since we've last connected with you all. And a lot has happened. As you all know, you all are in these communities as much as we are. And we see a lot of the accounts of what's going on across the country. We wanted to bring you a lot of the updates of what we're seeing and also what we're up to and why. And we hope that that might be useful to you all because as we've said before, we know that combating the virus really is a reminder that everybody's in it all together. We truly are in this together as a community. And whether it's a nursing home or a prison or a meatpacking plant or a school or any host of other settings, we know that when there's an outbreak in those areas, it very quickly spreads across the community and into our campuses, which is why we have a vested interest in making sure we're doing all the things we can by way of prevention. But next slide, if we could turn to that. You know, we've been starting with this picture as we review the state of affairs, and we've been using this as a way to update our internal employees as well. And what we like about this approach is it takes the snapshot of the last 3 weeks, and it looks at both the positive confirmed case count and then the overall death count, and it looks at the rate of growth during that 3-week period of each of those things. And the top line looks at the country as a whole. The middle line looks at the state, so Pennsylvania specifically. And then the bottom line looks even more specifically at the areas that Geisinger serves. And it's our information and our data from our testing results. And you could see that the country is actually, and I think you've seen some news accounts of this, the country is actually climbing at a pretty steep rate. In fact, it's accelerating overall as far as the number of total positive cases. You can see that the death rate is also climbing by about 15% across the country. If you zoom into Pennsylvania, we're climbing at a slower rate, which is a good thing. In fact, the rate is about half of what you would see across the rest of the country. That's a great thing. And then the death count is roughly on par with what you're seeing across the country. And then, of course, for our information at Geisinger, we're climbing at even a slightly slower speed than the state. And then our death count is also about half as far as the rate of climb relative to what we're seeing in the state and across the country. I think you may recall, we've said this before, the case count is actually the leading indicator. So that's what we see first. And then throughout this whole pandemic, what we've also seen is whatever trend we see with the number of cases, we tend to see that trend reflected in the number of admissions in the hospital somewhere between 1 and 2 weeks later. And then the deaths seem to come in a mirrored trend about a week or two after that. So the deaths you might think of as the lagging indicator, the confirmed case count as the leading indicator. And this is in fact how we do some of our projections and our predictive modeling around what we think will happen and so forth. Although to some degree, as you can imagine, there's a little bit of a guessing game because it depends heavily on people's behavior and the community overall. Next slide. This is what our bed capacity looks like overall as a system, and you can see that we've been able to manage our bed capacity pretty well. I think it's tough to see on this graph, but gradually our bed activity and the census of patients is slowly growing, and that makes sense as we've really for the last 6 weeks been bringing services back online. So a lot of the non-emergent or less emergent, less urgent surgical procedures and outpatient visits, as you all know and have heard from all other health systems, those were postponed at the beginning of the pandemic, and then probably about 6 weeks ago, we started phasing back in those services. And as we've done that, the activity level across our institution has picked up dramatically. The red portions of these bars represent the COVID positive patients that are hospitalized across all of our campuses. The blue represents the non-COVID. And you can see that overall, we still have a fair amount of bed capacity that we're able to manage, and that allows us to safely reintroduce those services and feel good that there's adequate bed capacity, even in the event of some resurgence of the virus. Next slide. I think this is a map that's familiar to everybody. This is the state's red, yellow, green. I think there's one lone county at this point remaining in yellow, but at this point, as of this Friday, the vast majority of the state will be in green. Now, what we've emphasized, though, is, and we've said this all along, we believe that there's a safe and responsible way to reopen businesses. We believe there's a safe and responsible way to reopen various healthcare services. But we know that in order to do so, it really depends on people's behavior. And so we're still at a point where the virus is out in the community, and we do need to be practicing distancing efforts, staggering and spacing of foot traffic, masking, screening where appropriate and feasible, and of course hand hygiene. And the combination of these kinds of interventions and preventive measures is what we've been out and about in our communities really advising, and Allison here is going to talk about that in a second. But we've been out pretty aggressively because we know that whatever we can do to mitigate and contain the virus spread, we're going to benefit our entirety of the communities that we serve. You'll also notice that in the green recommendations, it still advises that people avoid large gatherings wherever possible. And I might even put a caveat in there, and our infectious disease experts would say, large gatherings, especially in indoor environments, or especially in environments where people are going to be closer than 6 or 10 feet from each other, those are the highest areas of risk and the highest areas where you have interactions that are higher risk, I should say. And so those are the places where especially it becomes important to try to distance, try to mask, and of course be super aware of hand washing and so forth. Next slide. This is what our testing volumes have looked like. And I think the big key here is we see the spikes in early and mid-April. That's when we saw the biggest bolus. These are daily new positive tests that we see just from the testing that we're doing. We're very lucky. We're one of the first in the entire state. In fact, I think we were the second in the state after the Children's Hospital of Pennsylvania to have our own testing on site, and one of the first across the country. And as a result, we've had a little bit of a head start on the ability to expand the capacity of our testing, and we've been super happy and super proud to be the ones doing most, if not all, of the testing for our first responders in our communities, as well as many of the nursing homes in our communities, and at this point also some other higher risk areas within the communities that we've been extending that testing capacity to. But what you'll see in the most recent part here on the far right of the slide is these numbers are not zero. What that means is that every day there are new people testing positive. And as a result, we do need to be careful, even as we work to reopen all of the things and get back to some state of normalcy. But we can only do that if we're all being careful in how we go about that. Next slide. This is something that I'm going to do my best as an ER physician here to imitate our infectious disease chair who normally does this slide. But what this really represents is the notion that the infection is out there in the community. And if it's out there in the community, there is a scientific phenomenon called herd immunity, which you may have heard about. And herd immunity looks at a population, and if you have roughly 2/3 or more of the population who has immunity to any virus or any pathogen, over time, that population will do better and the infection will kind of contain itself. There's been some debate about how close or how far are we from herd immunity, and you could see the most recent study actually comes out of Sweden, where they did not practice any distancing whatsoever, and the philosophy there was, well, let's just let the virus run rampant and we'll get to herd immunity faster. And even after doing that, and they've paid a price, you know, they've had a higher death rate and they've had a higher infection rate. But with that being said, they recently published a study that despite all of those things, only about 7.3% of their population had been exposed and had developed presumed immunity. What that means is herd immunity takes a lot more than just letting the virus run rampant. And so I think it underscores and reinforces the fact that the distancing efforts, the masking and so forth, are indeed the best arrow in our quiver at this point, until a virus kicks in, which of course will help us get to that herd immunity level. But that's a neat development by way of the science, and I think worth sharing. I think the other is that, you know, as schools are looking at and evaluating whether they come back online, as businesses are now opening their doors and all of the things that we all want to see, and all of the things that we would say we can absolutely do, but we have to do them in a way that allows us to continue to contain the spread of the virus. And I think it's not the what, it's the how that's going to matter. And that's a lot of the message that we've been carrying out to the communities and to our employees, and what we've been doing in terms of talking to employers, schools, and other businesses around the area. Next slide. I think a lot of you, after our first town hall, asked about actually the clinical updates. And so we picked some of the highlights. Hydroxychloroquine, which made the news quite a bit. As the research got going with this, it was revealed that for this population, turns out it actually does more harm than good. So the FDA, the Food and Drug Administration, that weighs in on things like that, they've actually officially removed this from the guidelines because it introduces a fairly decent risk of sudden cardiac arrhythmia and death, which obviously you never want to give a drug that increases your death rate from the disease that you're suffering from. So that's been removed from the guidelines. Remdesivir, which is an antiviral medication, the good news on that is the research has shown, the early research has shown that that is effective, and so that's made its way into the guidelines. And then what has also been incorporated is the observation that the virus actually tends to produce blood clots, and so a lot of people present with things like heart attacks and strokes, which typically have a clotting dynamic to them. And so the anti-clotting medications have also been incorporated into the guidelines. And then the inflammatory syndrome that I think many of you may have read about in children, we have seen a case or two of that within Geisinger. We're very lucky to have a pediatric hospital filled with pediatric subspecialists that has helped us manage that. But that as well has a separate set of guidelines that we've been able to put together through the help of those experts. And so we've been doing pretty well, and the first patient we had with that syndrome has made a full recovery and has been discharged from the hospital. The other trials and research that we're still involved with, convalescent plasma, this is using the plasma of people who have recovered and infusing it into people who currently have the disease on the belief and hope that the antibodies will convey some sort of an immunity bolstered response is the best way to think about it. And we've been involved in that clinical trial through the Mayo Clinic Expanded Access Protocol. There's also a class of medications that we're involved with another trial, the sarilumab trial. And we have a research oversight committee that looks at this on a weekly basis. I think the key punchline here is that as a result of having really a long history of being involved in research, we've been able to bring the latest and greatest evidence to our patients in our communities, and also access to these experimental medications, which otherwise you really wouldn't have access to because they're still only made available through the context of a clinical trial. And we've been very involved in that effort. Next slide. So I'm going to turn it over to Allison because I referenced a little bit earlier all the things that we're doing with the different categories of community partners in terms of continuing to educate, continuing to help and advise wherever we can. Allison?
Thank you. So as Dr. Ru mentioned, we are working with multiple different areas within our communities as everyone's trying to navigate through kind of the current state and what it looks like in the future for many of our employer groups and schools and members. We've done specifically some work in our employer group settings and with our local chambers to develop some town halls, toolkits, and offer some virtual support. And I have a link on there that has access to our resource that's on our geisinger.org site that has some back to work resources, includes posters and hand washing information, social distancing information, and some other frequently asked questions by employers as they're looking to reopen or continuing to navigate through this journey. And those resources are updated regularly as things change, because we know this is definitely a dynamic type of situation and things are ever changing. We'll update that, and we address the content on that based on the direct feedback we get from our community partners and our employers as well. In the schools and universities face a similar situation. There's certainly a sense of urgency for those partners in our community who are looking to get ready to bring students back this fall. Lots of considerations and questions that are coming up. So we've relied heavily on the expertise from our clinical partners here within the organization to provide some guidance and support around testing strategies, education and prevention, contact tracing, and just overall consultation to try and help them as they start to create their back to school plans and navigate through this space. We are creating a toolkit specifically for schools and universities that will have K through 12 information as well as secondary ed information that we're looking to release in phases starting this week. And so we'll make notification to all of those partners when that becomes available. And we also have an upcoming town hall scheduled for the middle of July or beginning of July 1st, I'm sorry, that will communicate out as well for that piece. For our GHP employer groups, we really wanted to take a dedicated and specialized approach. And so we adjusted and dedicated our resources to allow for very personalized consultation and support, which meant that we were readily available to provide virtual consultation, but also be available to come on site if needed, if any of our employer groups wanted us to walk through their areas or get very specialized and customized in the needs for their particular organization. And the sales team, as well as other resources within the organization, also worked very closely with our employer groups to make sure they had the most up-to-date information that was being released either from the clinical enterprise or from other resources that were available in the Community Department of Health or CDC. So really wanted to try and make sure that we were readily available. And I think that localized support is really important and has provided value, especially as within Pennsylvania, we had even a lot of differences between counties. Our experts that were actually in those areas were able to tailor that education so it was very specific to those counties. We did do some virtual programming there as well as some town halls for the employer groups, and we also have an enhanced back to work digital toolkit, which I'll show you in a couple of minutes here, that provides some additional information for our members and gets very specific into kind of the benefit pieces that aren't listed in the overarching toolkit that we have. And then for our members, I think it's really important to note that we made some significant adjustments and tried to enhance our support for our GHP member populations. We moved a lot of our services to a virtual kind of approach, including telemedicine, but our health and wellness programs, we adjusted to be virtual, and we were really able to demonstrate some good success in those spaces. Also, our communication, really, again, making sure that we were communicating regularly as members needed additional information, as well as our employer group and broker communities. We expanded our home-based services, including our home monitoring devices, to adjust and allow for members to stay in their homes as we navigated through this process. And benefit adjustments were obviously made along the way and communicated out regularly. So a lot of work behind the scenes to ensure that our members had everything that they needed and were communicated to appropriately throughout this process. I think it's important to note that the real value is the fact that the Geisinger Health Plan is part of an integrated delivery system. And so that being part of that system has allowed us to stay clinically connected and have access to the clinical experts, but also to be able to have access to some of the innovations that have been developed as part of this process and the technology and tools that were developed along the way that we can then use and be able to offer to our employer partners and our members. They see the downstream of that. So as far as employer recommendations, we still, as Dr. Rue mentioned, we still are really trying to make sure that we're screening for symptoms before working, that we're really actively monitoring for symptoms. Temperature checking is important as well. We're still continuing that. And then testing when it's appropriate and masking. It still is very important to remain diligent. As he mentioned, all the areas that are going green, I think sometimes there's this perception that that means it's kind of a back to normal approach. And the reality is if we still want to contain the virus and we want to, especially going into the fall with flu season and as schools are reopening, it's going to be really important to make sure that we are doing our part to social distance and mask and make sure we're appropriately hand washing and monitoring those symptoms daily. So we have some recommendations that we've put up here. Some of you may have seen some of these before, but we are really focused on those couple pieces that I mentioned, but also avoiding non-essential travel, making sure that there's education and signage available, continuing work from home if that's possible, where it's possible, and then really monitoring the CDC and Department of Health guidelines for cleaning, but also just for updates. For those of you who have been going through this COVID journey over the last couple months, recognize that it is a bit of a moving target. And so there's a need to be able to allow for flexibility in your processes, make sure that you're staying current on the information that's out there and applying that information appropriately as you continue to stay open. The other important thing is to make sure that you're communicating with employees and highlighting the digital solutions that are available for healthcare services, whether that's telemedicine, other types of health and wellness programming, mindfulness type of programs. We know that for our own employee population, anxiety and stress, as they were dealing with this, not only in their personal lives, but some of them on the front lines. And in addition to adjustments in their work setting, where maybe they were adjusting to a work from home situation that they hadn't been in previously. And so we wanted to make sure that we had lots of resources available for them. So those are things that you certainly want to make sure that you're highlighting for your employee population. And then the information that's always available on the CDC website is a good place to reference as well. And we're very focused on the continued support during these times. So really, again, we'll continue to make sure that our employer and member communication is frequent. We have adjusted many of our services to support the COVID efforts, and we're going to maintain the dedicated teams to support you in your reopening efforts. So that's a priority for us, to be available to help you and support you. The sales team is available to help with any questions around enrollment or any of the sales and renewal questions that are coming up. But we also have teams available to help you if you have questions in regards to reopening and how we can support you and your employees over the course of the next few months. This is just an example I wanted to highlight. Sometimes there's a concern when you go from a high touch approach where you're providing kind of face-to-face interaction. Can you retain the same level of success when you go to virtual programming? And these are just two examples of some of our participants. We did move many of our programs virtually. We provided over 60 virtual education sessions, and we had over 400 participants in those sessions. But these were just two examples. And the smoking example, I think, is really important. This was actually an individual who had been smoking since she was 16 years old. And so 35 years was smoking. And, the fact that COVID definitely impacts from a respiratory standpoint, that was part of her motivation. But also she was motivated because she had the time to really focus on it. And we had just reached out to her, encouraged her to participate in this program, and she felt that it was really a successful way for her to get started with quitting. And she's been successfully quit now for several months. So she's been really actively involved, and we're staying connected to make sure she has the resources that she needs. This is just a visual of that digital screening toolkit that I referenced. This is the public-facing toolkit that everyone has access to. Again, listing some back-to-business resources and frequently asked questions. It is being updated regularly, but also has links to our Geisinger COVID hotline and other information that you may need. The GHP Employer Digital Toolkit is referenced on this slide, and we have the link on there as well. This gives a deeper dive and a little bit more information that's specific to our members, benefit questions, and some other pieces in there around the wellness programs and other enhanced services that are available. So we would really encourage you, if you haven't gone to that website, to go in there, take a look, provide us feedback. If there's pieces in there that you think are potentially missing or information that you think we need to include, we'd love to hear your feedback because this is a dynamic and moving toolkit, and we definitely want to make it valuable. Really, the development to date has been largely based on the response from our employer partners, so we want to continue to get your feedback in that area.
And Allison, how many have we gone out and actually distributed that toolkit at this point?
We've made it available. We did push out a communication to our members, and I know that the sales team pushed out communications. We've also individually met with over 20 different employers to have a more customized conversation, and we also reviewed it with them as well. And we have a couple more in the pipeline, probably about 5 more scheduled. So yeah, I think it's definitely been pushed out and then reinforced in a couple spaces.
But it's intended to be self-service.
For sure.
And then where they've requested additional help and resources, we've gone out and partnered with them.
Yep, absolutely. And then just the last slide, I wanted to take a moment and highlight some of the other services that we've provided that I think are really important for all of our members. As we know, members and our community partners and just individuals within our communities through COVID may have been struggling with being laid off of work or other situations, economic situations that required them to seek out help and other resources. We stood up a program or a platform called Neighborly. And this is really a web tool that's designed to allow people to search for any type of social determinant needs. So housing, food, transportation, if they're having trouble getting diapers for their child, anything that they need, they can go in here. They can search by zip code. This solution was slated to go live in October of this year. But when COVID hit, we really redirected resources to stand this up in a very shortened timeline. And we to date have over 8,500 programs listed, a large majority of those are local programs. There's a few state-run programs as well as a couple federal programs. The majority are very specific to the communities that our members live in. And they can actually go in, they can search for that, they can get connected to their healthcare partners, and it's available for anybody in the community. So we've seen a really nice uptake in usage for this tool, and hope to continue to see that increased usage. But I would definitely communicate this to your employees as a resource that's available. There's a lot of good information on there. We additionally stood up a discharge transportation program where we provided over 150 rides since March 30th. We recognized when our members and patients were coming into the hospital, when it came time for them to get a ride home, when we were certainly very locked down, many of the transportation partners had stopped giving rides or had ceased to provide the service. And so they were relying heavily on family members and friends who were hesitant to come to the hospital to pick them up, to bring them home. So we initiated a discharge transportation program to be able to cover that gap. We also stood up an emergency food distribution program, which we plan to retain. And that is really a program where anybody can reach out if they're having trouble sourcing for themselves or their family with food. And we have provided over 500 boxes of food to date, and those boxes are good for 3 days of food, but it also includes some healthy, fresh items as well that we've added in there. So if anybody needs that solution, that's listed in Neighborly as an option. And so all of these programs are available in Neighborly and can be accessed there as well. We also provided culturally sensitive information and education for our Latino communities and employers as part of our COVID response. We initiated first responder testing, enhanced our nursing home support, and we partnered with local food providers as well. So lots of efforts in the community as we started to go down this path, and we'll continue that work and effort specifically with our employer groups, our GHP employer groups and members, our schools and universities, and our community partners at large.
So earlier, we started with one of the earliest slides was around the rate of growth across the country, the rate of growth within Pennsylvania, and then the rate of growth of what we see at Geisinger. And at each of those cuts, you saw that we're growing fast, or we're going slower than what the state is doing, which is slower still than what the country's doing. I think it's been efforts like these that have really helped us swim upstream, so to speak. Rather than focus just as a delivery system, a hospital system, or a physician group, we've been able to focus on the community, and it's because of that integration between our health plan and the clinical enterprise that gives us even more reason to do that in this very deep way that Allison is describing. The other thing that I think is worth noting, as much as the battle on this virus has been clinical, as you all know, it's also been social, it's also been financial. The far-reaching implications of the virus, I think, has taken many across the country by shock. And that's what we've experienced as well. It is every bit of a social battle as it is a clinical one. It's every bit of a financial battle as it is a clinical one. And we know that there are a lot of people in our communities that have been severely impacted as a result of the virus. And these are just some of the ways that we're trying to dampen and mitigate that impact. I think if you talk about things like childcare, transportation, and food, we're very lucky, and I should have said this at the outset, Allison Hess is our leader here within the organization for all things related to wellness programs, as well as our social determinants of health. So a lot of our social programs, among a host of other things, and she's been able to quickly pivot her team and those resources and capabilities to deploy them to the communities in the case of this pandemic. And that's what you're seeing here in this Neighborly slide. So I think we've been lucky that we were doing stuff on food and transportation even prior to the pandemic. And so it was it was a lot more readily pivotable, if you will, for us than maybe other folks that were starting from scratch.
All right, well, thanks, Jawan. We do have some good news to report. A few weeks ago, and this is Kurt Roble, the interim leader at the health plan. A few weeks ago, we had some really good news. We learned that we were rated as the #1 commercial insurer in Pennsylvania. And this is a very exciting award for us to achieve. And it really is exciting to us because it hits on all aspects of the health plan, including billing and payment costs, coverage and benefits, customer service. Really, every point where we touch a member highlights that we've been voted as the #1 insurer in Pennsylvania. So we're excited about this result. To get that external feedback from our customers, our members, is extremely important for us. So again, we're excited about this result, and we think it really hits in on a lot of the factors that differentiate GHP to other insurers. As Jaywan and Allison mentioned, our tight connection to our integrated delivery system is an important point that makes us different. We always start with a clinical component rather than an insurance one, and this we think is a big factor in allowing us to achieve the award. Also, I'd say the local nature of our health plan. People that answer your calls, our members' calls, are people local to the community. People that pay claims are local to the community, and we think it's different. You're going to get better service when you're in the local nature of our organization. We just simply believe you're going to provide better service to your neighbors than someone who's, say, thousands of miles away. The last point is we've seen significant improvement in our call center performance. We've seen a significant reduction in our average speed to answer, our abandonment rate, as well as our waiting time. All things that we believe have improved our overall performance.
I think it's just the blocking and tackling that we've been working on. And to be fair, we know the health insurance industry is not known for its customer wow experiences, but I think this is a huge recognition for us that we're heading in the right direction and, in fact, differentiating ourselves as we've been rated the best. We obviously want to put a win streak together here, but as Kurt alluded to, there's been a lot of great work over the last few years that's positioned us to get this award, and we're going to continue to build on that.
Absolutely, absolutely. Beyond our operational performance, as we talked about in our last town hall, is that we're doing all we can to help members and groups financially during this difficult time. We view kind of the insurance company as providing two things. One is financial support, particularly in the most difficult times like we have now, as well as care coordination. And some of the things that we've done is we eliminated cost sharing for COVID testing and treatment for inpatient in-network services, and that's all the way through July 31st. We also have no cost sharing for telemedicine services through July 31st as well. So we're doing all we can to mitigate the impact of the pandemic, at least financially. The other thing that we're proud of is we've been working very closely with our employer groups to make sure that they can meet their premium commitments. I think to date, we have not termed any group by virtue of lack of premium payment. We've been working group by group. Some groups have left for other reasons because they've gotten coverage somewhere else, but we've been able to mitigate the financial impact associated with the pandemic. The last thing we've been doing is trying to provide different terms, like credit card payments for employer groups as well, to facilitate their ability to pay premiums. Other things we've been doing is just closely connecting with our broker community and employer groups through weekly communication. Again, we view it as important to reach out and connect on all aspects of COVID. Certainly business aspects as it applies to insurance, but even in many cases, more importantly, as Allison alluded to, is connecting on clinical issues related to COVID. As I suggested before, we're not just an insurance company, we're an entire system that includes an important clinical component. And we view that as an important part of our communications. We've also been consistent with that, doing a consistent outreach to members and providers. We've contacted all COVID positive members. We've had about 2,000 COVID positive members that we've outreached to. We're also reaching out to members who have not filled medications to make sure that they get the proper medication that they need. So it's a constant communication process for us. We've also been doing the same for our provider network outside of Geisinger. We've been having multifaceted provider town halls, frequent updates, as well as active outreach to providers. The name of the game, as we viewed it as we went through this COVID crisis, is to constantly connect both to our members and to our providers. The last one, an important point for us, is that we're doing all we can to ensure that we have a safe environment for people to come back and use our health system. Safety is the absolute key here. And I think as you look at our clinical appointments, we're up to about 82% of our pre-COVID level. So we're bringing people back. The key theme for all of you out there is we're trying to be as safe as possible. Allison highlighted some protocols that we have both for employer groups we work with, but also internally at Geisinger for employees. We also have defined protocols for patients that will be seeking elective treatments as well. So everything has been safe, but we're starting to come back online with enhanced services. And the last point I'd make is just, we understand that we're in a new normal at this point. We're not coming back, or at least not even contemplating coming back to our offices until the end of August. We are looking at opportunities for some, or even a majority of our employees to work at home permanently. And one thing that we've been pleasantly surprised with is that through the COVID crisis is that we've been very effective with people working at home. We've been able to maintain our service levels, and we've been generally optimistic, or also very happy with the results of that. We're also having, as you can see here, ongoing webinars for groups and brokers to provide enhanced communication. I think one theme that you're going to see that will come out of this is enhanced communication on our part to our employer group and broker communities, with these town halls being one clear example of that.
So we do have a few questions from folks in the audience. The first question has to do with, I hope I'm pronouncing it right, dexamethasone, steroid as a treatment. And has there been any discussion at Geisinger around using it?
Yeah, so that's also been added to our protocol just recently. And I think whoever's asking the question probably saw the news that dexamethasone is a kind of steroid that's used in other clinical scenarios, and it's been shown to have some improvement of outcomes in some subsets of people. And so it's not for everybody, and I think that's the key takeaway on all of these medications and therapeutic interventions is you have to figure out who benefits from the therapy, and then of course you have to figure out if they indeed benefit. But as that information is now becoming more available with the early findings of the research, dexamethasone is one of the medications that's been shown to be effective. It's only for a subset of patients, and that is part of our treatment protocol now.
That probably then leads into the next question in terms of the slide that showed protocols and trials. How does that play into vaccines, and is there any expectation that there is a vaccine?
So there are over 100 different vaccine trials going on across the world at this point, or I should say vaccine efforts going on across the world at this point. There are several in the country that have proceeded to clinical trials, and there are several stages of those trials, and a few of those have even progressed to, beyond stage 1. So I think given the amount of effort and the fact that there are a lot of people, smart people, laser focused on this, I happen to believe that we will have a vaccine. I think it's tough to say, though, exactly on what time frame. I think part of the challenge is going to be the manufacturing. So, you take a look at the typical vaccine development cycle, and it takes years. The good news is, I think with this particular effort, they've tried to accelerate and truncate as many steps as possible, while obviously not shortchanging the safety side of things. I think the question mark will be, even after they find the right vaccine or vaccines, how quickly are they going to be able to manufacture enough doses to treat, hundreds of millions, and if you're talking globally, billions of people. So I think that part's a little unknown, but from a lot of what I'm reading and hearing about, I think the view is, sometime by early next year, we hope that there's a vaccine that's more broadly available.
And then we have a question that it referred to the mentioning of the fact that it's safer to be outside in terms of the airflow. So, is there any recommendation in terms of improving the airflow inside a building or inside an office, but with the use of fans? Would that be a positive or a negative? And I don't know if we can answer that question, but
Well, we get asked this one a lot. This one's a tough call because if you look at the science of how the virus is transmitted, and this is where we're learning a lot, there's something called aerosolization, which means the tiny respiratory droplets get aerosolized and mixed in with the air. That's where you have a higher risk of transmission, because if you don't have that aerosolization, that's where the 6 feet comes from. Because it's a droplet, it will just fall to the ground because that's what gravity does. If you aerosolize it, and I don't know that it's definitively known whether a fan would aerosolize and that same droplet that otherwise would drop within 6 feet, are you now propelling it to go farther? I think that's the question. I think the bottom line is, and there's no fail-safe kind of, silver bullet here, but the things that we know reduce the risk. And that's what you want to do. With each intervention, you reduce some of the risk, and if you're doing them all, then you've reduced the risk by a lot. We know that outdoor is better than indoor because there's an infinite airspace there, and the density of even any droplets in the air is not going to be as great. We also know that distancing versus sitting or standing right next to somebody, distancing is going to be better. We also know that masking is better than not masking. The mask that I wear reduces your chance of getting the virus by 70 or 80%, and the mask that I wear reduces my chance of getting the virus by 20 or 30%. The mask that we both wear then reduces each of our chances by 80, 90%. That's a significantly lower level of risk. And now you could imagine masking and being outside and being spaced and practicing hand hygiene. Now you've really reduced that risk. And so that's what we've been advising. If you are in an indoor space, I think, and this is what we've done here at Geisinger as well, rooms that typically hold 25 people, we limit it to 8 to 10 people, and we make sure that they're able to be spaced pretty far apart. If it's an environment where there are windows and that's feasible to do, I think cracking a window and just getting an exchange of air without having fans that, it's unclear what the fans will do, but cracking a window and creating exchange of air, I think, is probably a better thing as well. Rooms with higher ceilings, where there's just more air and more things aren't as cramped, I think that helps as well. So there's a lot of little things. Some of them are just intuitive. Some of them are probably downright scientific. But that's how we've been going about it, and that's what we know thus far.
And I guess this is a question for the future, but it's asking, do we know what the color is after the green phase, and what will the guidelines be? The color after green. And I think that's a great question. Yeah.
Pretty good. Green means go.
Right.
I don't know that there is a different color in the color coding methodology, but I think, remember, green doesn't necessarily mean we're all back to normal. I think green means, yes, we could open things back up like they were previously, but we should still be exercising these precautionary measures wherever we can.
And that's what we have in terms of questions.
If no other questions, John, I think what we've done in the prior one is people can also submit their questions. Is that right?
Yes, they have been submitting the questions.
But afterwards, if they think of a question.
Oh, yes. Afterwards, if they think of a question. And, Allison mentioned in her presentation that there's a link on the website for people that if they do have questions, and that her team has been answering and getting back to them. And that there exists a frequently asked question spot on both the business resource page and the employer hub that people can get the information from previous as well as what comes in and we did not get to.
We can also push out the link to the toolkit to the attendees today as well. I think that might be helpful so that they have that information readily available and at the top of their inbox.
And the only other thing I'd mention is if anyone has feedback on these town halls, we're always looking for feedback and any information on how you view these town halls. And it really hits at some of our key themes at the Geisinger Health Plan, which is, our tight connection to the clinical enterprise. This kind of clinical focus is going to continue to be a focus for us, both at the system as well at the health plan. And, we also think it's important for us to get out in our communities and give you real local news on what's happening. I think the one thing that Jaywan mentioned is that COVID, people look at national numbers, and as we all know, that's interesting. It's a data point, but the most important data point is what's happening in our communities that we serve in central Pennsylvania. We're going to continue to do that. So again, thank you, everyone, and unless there's any other comments.
There's just,
is there another comment?
well, there's just in terms of everything that has been happened here is being recorded, and it will go to go.geisinger.org/employer hub. I think it takes probably 2 to 3 hours before it actually ends up getting posted, if even sooner than that. There is a question here about the time frame that they're pushing vaccines to be ready without doing the proper amount of human testing. If there's an opportunity to answer that question, we do have some time.
Yeah, there are some efforts to see if there are some shortcuts to just parallel process some of the vaccine development. And I know of some efforts, I believe in India, where they're actually starting the manufacturing, and they're willing to take the risk that if the vaccine doesn't work, then they just throw out all the vaccine doses that they've manufactured. So there are efforts like that. I think the key is going to be to not sacrifice the safety elements of the process. There's a reason why drugs and vaccines go through different phases of their trials, and each phase is intended to achieve a slightly different purpose. I think throughout history where we've taken shortcuts on those phases, again, sort of like the hydroxychloroquine, you don't want to do more harm than you are good. And so if you're killing people because the vaccine isn't safe, that's clearly not the right outcome. And so I think we have to be careful about, yes, we need to accelerate and see where we can shave off some timing from the process, but not sacrificing the safety at the same time.
And the next question is around predictions. This question is specific around sports activities, but in terms of, the oncoming of the flu season and, where we're headed in terms of health and safety, is there any sort of outlook or prediction that you would give in terms of, have we seen the hard part of this? Are we going into a softer side? Does the flu add complications to this? What do we think?
I think most of the clinicians and scientists that we have in our system and that we talk to across the country would say that the difficulty is going to be with the fall and flu season. And the reasons for that are a couple. One, the folks who present with the regular flu or respiratory cold and upper respiratory infection kind of symptoms, those same symptoms are going to be very difficult to know if they're flu, if they're cold, or if they're COVID. And so it will put quite a strain on the testing capacity, which is why we've been diligently expanding our capacity from day one. Because having that ability to test immediately to know is this COVID or is this something else is going to be critically important. But if you look at the entire industry, they're not at that same testing capacity. And so I think that's going to introduce strain on the system, because what will happen is if you're not sure, you're going to have to presume that they have COVID until you get the test result back, which, still, if you're not doing on-site testing, could take days. And so that's a challenge number one. Challenge number two is we know even from what we were seeing back in March that when people have both COVID, the virus, and flu together, because it's possible to have both, your outcomes are substantially worse. And so the big risk is going to be as we see flu season come back into the swing in the fall, we're going to have some risk of people that have infections of both. And those are people whose outcomes are significantly worse. And so this year more than any other, it's important every year, but this year more than any other, we're going to have to be pretty aggressive in making sure that people get their flu shots. Because we know that flu shots aren't 100% effective, but same thing, if you could reduce the risk of flu by 60, 70%, that's a heck of a lot of fewer flu folks walking around in the community. And that's going to make a huge difference. And so we push it every year, both with our employees and with our patients and our members. This year, we're going to be even more aggressive on that. And that's the reason why.
Thank you very much.
Thanks, everybody.
Thanks, guys. Thanks.